Hi, my name is Kalani, and I am a student with Midwestern University. And today we're going to be doing a acute care patient visit, and we're going to be using some lines and trying to manage them, and also mobilizing our patient. So here we have our patient Mel, and so now I'm just going to do a patient encounter. Hi, knock knock. Hi, my name is Dr. Hayes. Can I get your name and date of birth, please?
Melissa, but people call me Mel. Date of birth is April 45th.
April 45th?
Yep. 1942.
1942. Beautiful. That's exactly what I have on my chart, so let's get going. What's up? My name is Dr. Hayes, and today we're just going to be trying to get up and moving, okay? So, have you been up at all?
No.
No? All right. How has your pain been today?
Probably like a 6.
A 6?
It'd probably be a 4 if someone here had something to drink.
Okay. Okay, unfortunately, we don't offer that in the hospital today, but something that we can do is to help is movement. Actually helps us feel better, okay? So, because we're moving our muscles are pumping all of our fluids back to our body, our circulation. So, all of that is going to be helped with movement today. Sound okay?
Sounds fine.
All right. So, first, you just came out of the surgical center, right? So, do you have a drain on?
Yes.
Is it okay if I palpate?
Yeah.
Okay. It's like right on the right side here. Yeah. All right. And it looks like you also have a catheter down over here and your art line. Okay. So our first objective is we're just going to sit up. All right? Does that sound all right to you?
Yeah.
Okay. So what we're going to do is you're going to roll towards me. Okay?
Okay.
So you're going to roll to your left side. I'll walk you through all of it though.
Okay.
Okay? So all you're going to do is bend your knees for me. Keep them together. Okay? And then they're going to already be here. What I want you to do, let me grab this line here for you. Okay, I want you to take this arm and wrap it to this side. Yep. Reach all the way as far as you can, And then without a lot of effort, we're going to roll together, okay?
Okay.
Ready?
Ready.
1, 2, 3, roll. Great. Great. Okay, and now, not pushing on this line, using your elbow on the left side. I want you to push through your elbow and lift up, and I have your feet, okay? 1, 2, 3. Good job. How you feeling?
So good.
So good. Great. You feel stable enough where I can leave you?
Yes.
Okay, I'm going to go grab a gait belt, and I'm going to fix your gown, okay? So that we can get up and move modestly, all right?
All right.
All right, I'll be right back.
Bring that bottle of hand sanitizer.
Okay, Mel. Just going to tie you up. How you feeling?
Feeling thirsty.
Feeling thirsty? Would you like some water?
Oh, never mind.
Perfect. Okay. And then I'll put the gait belt on you, okay? And it looks like we're sitting on our catheter. All right, here we go. All right, we're just taking a look at your blood pressure. How's your blood pressure feeling? Any dizziness, lightheadedness?
No.
Shortness of breath?
No.
Okay. Alrighty then. I'm gonna move through ya. All right. We're just making sure we're above that drain here so we don't squash it. Okay. This gait belt is just for safety, just because we haven't been up in a little bit, okay? We just want to take precautions. And usually we would use a walker to move and ambulate with you, but today we don't have a walker, okay? But we don't have a walker available, okay? So, do you feel like that's doable?
Doable.
Okay. So, I'm going to use this to monitor your vitals as we're moving throughout. We'll just put it on here. And we're checking heart rate and just your oxygen, making sure everything's okay there, okay? All right, looks pretty healthy. You're 96 and 89, just a little high, but that's okay. All right. All right. And you have your socks on. Good. So all I want you to do now is, without using this hand, we're going to just scoot to the edge of the bed where your feet are planted on the floor. Great. Okay. And I am going to bring this chair a little bit closer to you. Okay. And we're going to make sure not to sit on the catheter, okay?
Okay.
All right. Bring that out in front of you. I know this gown is just a little bit tight for you. There we go. Okay. So on the count of 3, we're going to move to the chair. All right?
All right.
If you need to, you can grab onto my elbows or I'll lock you in. Okay? Okay. So just like this. All right? And you can use this hand too, as long as you don't put any pressure on it. Okay, ready?
Ready.
On the count of 3, we're going to lean forward over our toes, and we're just going to stand and pivot. Okay? Ready? 1, 2, 3, stand. Good. And pivot and down. Good job. How are you feeling?
Great.
Great. Good job. Let's just reassess those vitals here.
I think I sat on my catheter.
Oh, no. Oh, no, you didn't.
Okay.
We moved it out of the way. It's okay. But I will pin it to your gown. Or I'll pin it to the IV before we start moving. How do you feel about walking today?
Feel fine.
Feel okay? All right. We'll get you going on the IV pole and your art line, okay? We'll just pin it. Usually we'd pin it at the same level on the IV pole as where for the transducer, okay? All right. So we pin it at the 4th intercostal space, just right at your 4th rib. Make sense?
Mm-hmm.
Okay. How are you feeling?
Feeling good.
Any shortness of breath or anything like that?
No.
Okay. So there's the transducer right there. Make sure that's nice and stable. Good. We'll also pin the catheter when you stand up because it's kind of got a short line, okay? Okay. Are you ready?
I'm ready.
We're going to start walking. Yeah?
Mm-hmm.
Okay. I'm going to bring this out in front of you. Actually, not quite. Okay. Same idea. We're going to stand up. Oh. And your vitals look okay. And we'll just keep that on you. Do you mind wearing this as a bracelet? Okay, perfect. Okay, ready?
Ready.
Same thing. We're just going to stand, okay?
Okay.
Ready? And 1, 2, 3. Great. You mind turning? Gorgeous. And now we're going to pin the catheter on the walker. I'll handle the IV pole, okay? But normally the transducer would be at least level with you, okay? So I'll walk behind you with the pole, and you're going to just walk forward, okay?
Okay.
You just let me know if you have any changes in symptoms. Okay. And then we'll go back around, turn around. Yep, just like that. Great job. How you feeling?
Good.
Great. We'll just move that catheter out of the way. All right. Ready? And sit. Nice job. How are we feeling, Melissa?
So good.
Oh, sorry, Mel.
Yeah.
Okay, good.
I think you owe me a beer for that one.